What is fibromyalgia? The answer often surprises people because many think it is the symptom of pain. But in fact, fibromyalgia is a syndrome that has many more symptoms. This shows you how misunderstood the illness is. So in this video, I'm going to explain to you exactly what fibromyalgia is, and in the process, we're also going to bust some of the terrible myths that increase the emotional and physical suffering of people experiencing fibromyalgia. And I'll share with you what you can do to help reduce that. If you ask what is fibromyalgia, then looking at the word, where it comes from, might be your first step. But in fact, it's actually somewhat misleading because it is made up of the Latin and Greek words to mean fibrous tissue and muscle pain. But in fact, the pain is not just in the muscles, and not only are there more core symptoms, but actually there's a very large range of other symptoms also. Now, often people think of fibromyalgia as being like arthritis, for example, like, my fibromyalgia is acting up. But actually, a symptom flare-up in fibromyalgia is much more pervasive and much more severe than that would suggest. It's not just about experiencing pain. The American College of Rheumatology lists the primary symptoms as widespread pain and tenderness to touch or pressure affecting muscles, joints, and even skin, severe fatigue, sleep issues, and cognitive problems. They also list other problems such as depression or anxiety, migraine or tension headaches, digestive problems including IBS and GERD, and an irritable or overactive bladder, and pelvic pain, as well as temporomandibular disorder, which is often called TMJ. However, many more symptoms often occur in fibromyalgia, and for a fuller list, please see the website using the link below. Now, some of these symptoms are actually present most of the time, but others waver over time and become exacerbated by too much activity, by stress, and even things like exposure to certain foods or smells or weather changes. These fibromyalgia symptom exacerbations are called flare-ups or fibroflares, and they can last days, weeks, or even months. Because patients have traditionally been diagnosed by a rheumatologist, many people think that fibromyalgia is an autoimmune disorder. However, this is really more of a historical anomaly, and the American College of Rheumatology makes it very clear now that fibromyalgia is actually a neurological disorder and not resulting from an autoimmune inflammation, joint or muscle disorder. Now, at the time of making this video, the American College of Rheumatology lists the cause of fibromyalgia as unclear, but it points out that the current research suggests involvement of the central nervous system. But what has created this lack of consensus about the cause of fibromyalgia and so much confusion? It is that the central nervous system dysfunction actually affects every system in the body, creating a large range of symptoms, and this multi-system dysfunction sometimes leads doctors to make multiple diagnoses or no diagnosis at all. And because fibromyalgia is a heterogeneous illness, meaning that it manifests differently in different people, sometimes the illness is seen as a wastebasket diagnosis or not a real illness. With so many of the symptoms difficult to measure and based on patient reporting, the myth that the illness isn't real or that patients are hypochondriacs or crazy or depressed has been created over time, and it's still prevalent in some circles. Now, not only have I had this illness myself, but I've interacted with thousands of people experiencing this illness. And I can categorically assure you the illness is real, and so are the symptoms. Anyone can experience this illness, and people can have different symptoms, different progression in their experience of the illness, and different severities. Now, patients often think that their experience is unique until they learn of others who have the same symptoms as them. And fibromyalgia isn't as rare as you might think. You can check out our website using the link below to get more details on various research papers on the estimated rates of fibromyalgia. But one key feature is that more women than men appear to experience fibromyalgia. Fibromyalgia can be triggered by a range of things, from infections to other physical stressors such as accidents, surgery or childbirth. It can also be triggered by psychological trauma or other stress. So fibromyalgia is a very real physical illness with a large range of symptoms. And it's still not that well understood by the wider medical community. What's worse is that people are sometimes not believed about the illness being real, or that poor information is spread suggesting the illness is purely psychological. This can really be very upsetting and unhelpful for people experiencing fibromyalgia. But you can make a difference, and you can help change how the illness is perceived by letting others know about what fibromyalgia syndrome really is, and posting a link to this video or embedding it on your blog or website. And of course, give us a thumbs up. For more details on what fibromyalgia is, you can also visit the website on the link below. And of course, you can subscribe to the YouTube channel and watch the full series of videos, including videos on diagnoses, treatments, and recovery from the illness. Hope you leave a comment below, and I'll see you in the next video.